Joint replacement can be a life-altering experience. And that's sort of the fun for me, to try to help patients decide, is now the right time for a joint replacement? The first part is, have we tried all the non-operative things that we can do? And then when the non-operative things fail and the patient is having a significant curtailment in their lifestyle, then you mutually decide to go ahead with the joint replacement. We don't have a one-size-fits-all philosophy.
The surgeons, the physicians, the nurses, and the physical therapists come together to communicate and find a plan that will best fit that patient.
We take pride in the fact that we can treat each patient as an individual.
We like to start with kindness and make them feel that they can talk to us and be comfortable.
We have patients see physical therapy prior to the surgery. We educate them about what their inpatient hospitalization is going to be like. I make a habit of calling my patients the night before surgery and saying, it's Dr. Giamatti, I'm all set to do your surgery tomorrow. Do you have any questions? We frequently will operate on one day, and then on post-operative day one, get them out of the hospital.
Our team helps the patients feel comfortable by providing an individualized plan of care. So it's not just a series of exercises that we give a patient. These are your exercises, and we remember your name. We know what's going on with your life, how many cats you got, and just make you feel comfortable and at home.
We work very hard to get patients home so that they can enjoy a more rapid recovery.
It's taken a lot of decision making to be here, and we want them to get through this and be happy.
The reason to do a joint is to improve the patient's function. The phrase that I love to hear is, "You've given me my life back."